here to give subcutaneous injection, and I have gathered my supplies. So I will go ahead and confirm the 6 slides of medication administration, which is a night patient, night time, night drug, night dose, night route, night documentation. And then I will compare the EHL with the medication that I have at hand. The order says give heparin 1000 units per dose, and the medication that I have at hand, I have heparin 10,000 units per 10 ml. So when I do my calculation, I'll be giving 1 ml of heparin, and my record on EHL tallies with the physician orders and what I have at hand. I'll then go ahead and approach my patient. Good morning, Mrs. Smith. My name is Valentine, and I'm here to give you your medication. Is it a good time to do that? Okay. So then I'll go ahead and provide privacy, perform hand hygiene, and Mrs. Smith, may I use your list pad to confirm your name and date of birth? That tallies with my record. So, do you have any allergies to food, medication, or any seasonal materials? Okay. So the reason why I'm here today is because the physician ordered you that we give you heparin. Heparin is an anticoagulant, it's a blood thinner. It works, it helps decrease the chances of forming clots, and it also helps ease the already existing clots. It works by preventing blood from making clots or clotting. And when you get in this medication, you may experience some easy bruising. You may experience hair loss. You may experience bleeding. You may also experience some pain on your skin or where the injection site. And when it comes to the adverse effects, you may experience some heavy bleeding, uncontrollable heavy bleeding, or thrombocytopenia. You may also experience some numbness and rash on the skin. So I want you to let me know just in case you have any of these feelings, because we need to take appropriate measures on those. So do you have any question? Okay, so before I inject these, I should also let you know that when we inject, you may experience some stinging or burning sensation. This is normal, but when it continues getting worse, you should let me know, or you should let the physician know. So then I'll go ahead and perform hand hygiene and don't clean gloves. I will be giving 1 ml of heparin based on my calculation. The order says 1,000 units per dose, and what I have at hand is 10,000 units per ml. So when I do my calculation, I'll be giving 1 ml. So I have 1 to 3 ml of syringe, and I have 25 gauge needle. So I'll go ahead and first prepare my medication. I'll prepare my medication by first cleaning the cap for 25 seconds. I will then go ahead and inject air on my syringe. In this case, I'll be working with 1 ml air, because that's the medication that I intend to draw. So 1 ml. Of air, and I'll go ahead and inject the air into the vial. I will inject all the air in the syringe. I'll then go ahead and invert the vial to be able to draw the medication. I'll be drawing 1 ml. I'll make sure there are no bubbles. 1 ml with no bubbles at all. I'll secure that. I'll then inspect the skin to make sure there are no masses, there's no skin breakage, edema, and there are no any concerns on the skin. And I will probably palpate using my finger in one hand to feel that I have enough skin to be able to accommodate the needle that I have. So yeah, I see that. So, and then I'll go ahead and clean the area. In marking, have an anatomical red mark where I'll be doing my injection. I'll be careful not to introduce new dirt on the clean area, and I'll wait for it to dry without having to touch it or anything. Using my thumb and my finger, I will grasp the skin so I can have ample I can be able to inject without having to worry about the bone. So, and I think that now it's dry, so I'll go ahead at 45 to 90 degrees, holding my syringe with my dominant hand and pinching the skin. I will progress at 45 to 90 degrees. Let go of this and hang on to it with my non-dominant hand and inject the medication quickly. I am not gonna massage, but I'm gonna remove these and not put it in the sharps. I don't see any concerns, so I'll just wipe it down. And I'm not gonna massage, I'm just gonna let it be. I will remove my gloves, perform hand hygiene, and document.